Hi everyone, thank you for your time for joining us on this online sharing session. So before we start, I would like to give you all a short briefing on the program flow for today. As usual, we'll start off with our special topic sharing, which today will be shared by our medical science officer, Fida. And today's special topic will be how reducing electron helps to prevent cardiovascular diseases. So if during the sharing you have any questions, you can jot down. And after that, in the Q&A session, you may ask your questions in the chat box, or you can unmute yourself to ask the questions yourself. We'll try our best to answer all of your questions. And after that, we will move on to more sharing on more information about reducing electron and also some testimonials regarding this reducing electron treatment. So without further ado, I would like to invite our medical science officer, Fida, to share about how reducing electron helps to prevent cardiovascular diseases.
Hello, you can hear me? Hello? Hello, can you hear me? Jenny, you can hear me? Everyone can hear me?
Okay.
All right. Okay. So thank you so much for Ms. Shirin for being our MC today. So Assalamualaikum and a very good evening to everyone. My name is Dr. Nawafida Ismail. I am a medical science officer in NIO International Berhad. So our topic for today is about cardiovascular disease. So basically, also known as a heart disease. So cardiovascular disease is a term of medical terms. So the normal term is that we call as a heart disease. So as you all know, heart disease kills many people around us every year. So it could be one of your family members, your best friend, your close friend. So we need to know how to prevent the heart disease can be occur. Okay, so here I will share my slide with you all. Okay, so here I want to share with all of you that I find out these two articles are regarding cardiovascular disease or heart disease. So as you can see in the picture on your left side is a heart disease top killer of Malaysian in 2019. So since 2019 also, we can see that a lot of people die due to the heart disease. And the right one is a 5 principal causes of death. So one of the most, we can see the first top causes of death is ischemic heart disease. So ischemic heart disease in the previous last week we talked about because of stroke. So ischemic heart disease is one of the killer causes that a lot of people die nowadays. So that's why I said this statistic will be continuous increase if, let's say, we did not aware of our health or doesn't know how to prevent it. So maybe your family members can die or your close friends even can die. So you need to know what is the cardiovascular disease. So basically I want to ask you, have you know that any of your family member that have heart disease or simply irregular heartbeats? Any one of you? If let's say you have, so please ask your family member to know exactly what is happening inside your body. Okay. So before we move further, I will ask you, I will tell you what is cardiovascular disease. So cardiovascular disease is that the disease that affected our heart or the blood vessel. As you can see the picture on the left side, you can see the heart. There is a circle, a bit the blockage. The blockage of blood vessel will be affected of our heart to pump. So that means our pump blood is not, it's not working. So that's why we can see the circle black color become dull, is the gray one. We call as a dead muscle tissue. So you must know that our heart muscles require oxygen in blood to survive. So that means our blood vessel need to be very healthy to supply the oxygen towards all part of the body. Okay, so the next one. So this is the types of cardiovascular disease. So I just mentioned four main types. Okay, there is a lot, but I will just mention four main types. This is the top one. So the first one, as we can see here, heart attack. So as you know, heart attack is that's mean the blood flow is reducing. So that's mean your pump blood is not enough. So second, the stroke we call as ischemic stroke. So ischemic stroke is blocking in a blood vessel. So that's mean blood clot somewhere in your blood vessel. And the third one, arrhythmia. So arrhythmia is irregular heartbeat. If let's say you have sometimes you just sit down or just wake up from your bed, suddenly your heartbeat is not well. I mean like suddenly fast, suddenly too slow and too fast. You need to check because sometimes it's because your heart is not pumped enough to deliver oxygen all part of your body. Okay, and the last one, heart failure. So heart failure is doesn't have enough blood to pump. So that means we can say your blood is not enough. So your blood is not enough, the nutrient and all oxygen could be supplied. All right. After we know that, okay, I will share you risk factor. Actually, we can say this is as causes because to be honest, the exact causes of cardiovascular disease or we call heart disease isn't clear. Okay, but there is a lot of risk factor that can increase the cardiovascular disease. So as you can see that the first one, high blood pressure. Why high blood pressure? It's because high blood pressure can damage your blood vessel. So sometimes you can see some of the people that having high blood pressure, they will feel headache, they will be like suddenly is unconscious. So because your blood vessel is already burst, so you need to take care of that. And second, smoking. So the harmful substance and the tobacco and nicotine can damage and narrow your blood vessel. All right. So the third one, high cholesterol. So high cholesterol is the fat. The fatty acid will blockage of your blood vessel, so the blood clot will form. So this is how to say the blood flow cannot move smoothly. And the next one, diabetes. Of course, the increase of blood sugar can damage your blood vessel. So please take care if let's say you consume too much of sugar in your blood, can damage of the blood vessel. On the next one, your family history. Maybe your mother, your parents can have the cardiovascular disease, can be one of the reasons that you have the cardiovascular disease. And the next one, obesity. So obesity can increase the development of diabetes and high blood pressure. Okay, again, so these 6 risk factors is very important. Why? It's because this is major. You can see some of my parents or even my parents or your parents or other your family members, your friends could be develop one of these risk factor. So if they say they have, please check. Doesn't matter if like once in a while, it's okay. At least you do regular checkup. Every once in a year is enough. At least you know what is happening in your body. Okay, so the next one, this is the treatment available in the hospital. So this is, I just mentioned 3 main treatment we call a major treatment in the hospital. The first one is a medication. So for sure, if let's say you diagnosed with the heart disease or blockage of blood vessel, blood clots, so immediately the doctor will prescribe you the beta blocker and bisoprolol. So this is the normal medication that the hospital will be given. So the next one, surgery. So the surgery usually mainly we do is a coronary artery bypass. The next one, cardiac rehabilitation. So this one is we do, I have to say the physio, the exercise to increase your pump blood be more faster and more bigger. So as basically this treatment is just to aim to release your symptom. It's not to reduce, just relieve your symptom. And second one, reduce the risk of disease getting worse. So again, this is reduced, not just like to say, confirm you do this kind of treatment, you'll be healthy. No, it just reduce the risk of this disease getting worse. And the last one is just to prevent the complication occur. For example, like if let's say you diagnosis with cardiovascular disease, maybe you need to admit it to the hospital for such a long time, maybe 1 month, 2 months, or depends. So this treatment is just to relieve. Again, this is not to say confirm you are be happy. No, it's just to relieve the symptom. Okay, so by doing this, I know some of you will wonder, okay, I don't want to do this treatment. I want to focus more natural way, which is how to prevent. So this is how cardiovascular disease will be preventing. So the first one, you need to prevent by maintain the healthy weight. So that means you need to know your BMI calculations, whether your body is too obese or just a middle, just a very underweight. So you need to maintain of your healthy weight. And the next one, uh, exercise regularly. So exercise regularly, that's mean moderate, not every day exercise, you play some sports or whatsoever. So you need to do moderately, maybe 3 times a week. If let's say you playing some very high sport, that's mean like you are running, you are cycling, that's mean you need to do kite maybe twice a week. It's not every day. If let's say you're going for it, it's not also good. It's not good for your health also, especially on your palm, because the blood is not rushing to push your blood vessel oxygen. That's the thing. So again, I say exercise regularly. That's mean moderately. And the third one is your diet. So your diet, you need to balance. That means you eat veggie, you eat protein, and less sweet, less sugar. So you need to monitor your diet plan. So especially in terms of food. And the next one, stop smoking. Okay, this one I'm not saying that you must stop immediately. It's okay. You just trying slowly. Like for example, a day you smoke about 2 packets of a day. So try to cut down until 1 package a day. And after that, slowly try to cut down from 1 packet, maybe 1 packet can be stand until 3 days. So that's the how stop smoking is occur. It's not like immediately stop smoking. Okay, and one of the other ways who are very important, we use RET. RET stands for Reducing Electron Therapy. So this is how I want to focus on our topic today, the reducing electron therapy. So this is one of the how to prevent your heart disease will become worse. So what is that? So this is just basically a biochemical reaction that provide negative charge, which is a negative ion towards your body. So the main effect of RET is improve blood circulation. Let's say I state is 5 main effect. So one of the effect I want to highlight is that improve your blood circulation. So why? This is very important. Every disease around the world is starting when your blood circulation is not good. Okay, so that's why I want to highlight to improve your blood circulation. When your blood circulation is okay, that means your oxygen, your nutrients, your carbon dioxide will be good. So that means the disease will be prevented. Okay, so this is, I will show you how the picture of your blood vessel. So this is the blood on your left side, as you can see, that is abnormal red blood cell. So you can see the positive and negative charge, they are clumping towards each other. Why? Because there is attendance of positive charge. That's why the blood is clumping. So it clearly shows that your blood circulation is not good. So on your right side is we call as normal red blood cell. This is what we want, the healthy cell. As you can see there, that is picture negative charge. Where negative is will be repelled. So hence the blood circulation in smooth runs smoothly. Okay, so I will focus more on how reducing electron therapy can help. So I just say this is not to prevent, this is not to cure or to comfort you be healthy, it's just to help you to prevent from the cardiovascular disease. So by the first one, it will decrease in serum MDA LDL level. This is as oxidative stress marker. So how does this marker can affect our body? So I will explain one by one. As you can see the picture on the circle part, if let's say you are diagnosed with high blood pressure or high LDL cholesterol, which is the bad cholesterol, it will perform fatty acid. So as you can see the picture, you can refer the picture on your right side, the blood vessel. So you can see when the fat is starting to perform, the blood vessel is narrow. So this oxidative form we call as MDA LDL level. So when this is happened, we call the term is atherosclerosis. Okay, this is just a term of medical. It means narrow your blood vessel. So when this is happened, it will cause ischemic stroke. Remember, just now I tell you, as cholesterol is one of the risk factor or one of the type of cardiovascular disease. So when this is happen, that's why reducing electron therapy can help. So by this one, RET can travel flow inside your blood and attack the blood with have the fatty acid, and the blood is dispersed. Dispersed is that means your blood vessel is be in singular shapes, and then the serum MBA will be decreased. So when this is decreased, the blood flow also will be increased. Okay, this is second one. The second point, how does reducing electron therapy can help? By decrease in TBARS, acid reactive substance level. So we call as thiobarbiturate acid. So this is marker for lipid peroxidation. So the first one, RET, reducing electron therapy, will help in terms of reduce the high lipid peroxidations. When this is happened, it prevents the form of fats by replace the loose electron. After that, the blood flow also will increase. Okay, so the next one, increase peripheral blood flow. This is how the measure, again, I said to you, among all the diseases around the world, is commonly the main factor is because the blood vessels, the blood flow is not well, the blood clot is performed, all that. That's the beginning of any of the disease in the world. So by using this reducing electron therapy, it helped to increase the peripheral blood flow. As you can see the picture above, from first minute is 0 minutes until 50 minutes later, the blood flow will increase by the rate. As you can see the graph on your slide, you can see the graph is moderately increased. So these 3 points that how reducing electron therapy can help in terms of prevent cardiovascular disease. Okay, as a conclusion, reducing electron, they can help to reduce the cholesterol level, reduce the formation of fats, and enhance blood circulation. So again, there is no side effect, and we promote natural healing and treat root, not the symptom. So again, I want to tell you, we need to prevent. Okay, we need to prevent before it becomes worse. Even though we know it's prevention is better than cure. So that's what we want to do. If let's say it's happening, your family members or some of your close friends happen to have this kind of disease, please make sure you know what food you need to take, what other treatment are available, or what are step by step you need to do. So you need to know. After that, slowly, then you can know which treatment are suitable for them. All right, so this is our email and hotline. So if there are any questions or any want to know more about us, you just can email to us and call the hotline number. So far for me, thank you so much. Any question? We are open for question right now. Is there any question that you want to ask? And you feel free to ask and unmute your microphone, or you can type in your chat room. So far I can see that there is no question in chat room, or anyone want to ask. So maybe I will pass to Shirin. Miss Shirin, are you there?
Okay. Thank you, Frida, for a very nice and informative sharing. So if we don't have any questions, we'll be moving on to the next sharing, which is about more on the testimonials and also the reducing electron treatment. So, Madam, would you like to share a bit on the testimonials first?
Okay. Can I invite Roslan to talk about his experience, I think his last month experience about his heart problem. Can we welcome Roslan, Haji Roslan?
Yes, Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everybody. Can you hear me?
Yeah, good afternoon.
Yeah, okay. All right. Dr. Vida, very good information, very good explanation. This is the first time I heard about this from you. And at the same time, I would just like to tell you a bit more about my recent experience or recent problem with my heart. So this year is not a good year for me because first in February, I got my kidney problem, my urea very high. So I went to, because I've been going to hospital Selayang for a long time, I think about 15 years. So the specialist, Dr. B, decided to operate me and then also to put me on water dialysis. So that's what I'm doing now. I'm doing the water dialysis 4 times a day. Then after that, after that operation, I cannot focus properly. When I walk, I cannot walk straight. Sometimes I might fall. So I had another appointment with a doctor. So the doctor told me they want to do the brain scanning and also to check a little bit more. So on the 27th of, then I was admitted for the second time. So somehow or other, the patient next to me, he got the COVID-19 positive. Then it spread to me, so I got it. So I stayed in the hospital for 20 days. So I've been discharged sometime in the end of May this year. But I'm okay now, no problem at all. So on the 23rd July this year, I went again to give my blood to the doctor because they want to check. Yeah. So when I went there for the first time, when they took my pressure, so my pressure went up very high. 171 the top and the bottom 110. Then I told the doctor, the sister, that I take it in the morning before I do my dialysis. My blood pressure is only 130, 70, 120, 60 like that. How can I go so high? They said, okay. After they took my blood, then I went and see the doctor. So doctor also do the same thing. And then he takes my pulse. So my pulse is only 41, which is no good. Yeah, the heartbeat 41. Then doctor suggested to me, let's go to 7th floor in Hospital Selayang, that is where the ward I was admitted before, to take the ECG. So then I said, okay. So they took the ECG. The doctor gave me a letter because Selayang, they don't have the cardiac specialist. So they asked me to refer either to go to hospital UITM Sungai Buloh or Hospital Serdang. This is under government. So I went to Sungai Buloh because Serdang is 100% under COVID hospital. I went to Serdang. So Serdang told me, well, I went to Sungai Buloh, sorry. So Sungai Buloh told me it takes 6 months only that I can see a doctor. They are very busy. I said, okay. Then I decided to go to IJN. So, but then IJN need a referral letter. To show you the end of the day, I go to get the letter from Hospital Serdang. But when I went back to home, so when my pulse is 41, I was very worried, So I spoke to Madam E. I called Madam E, Madam, just for your information, my heartbeat now 41, 39 and all that, So what can we do? So she said to me, no problem. Do it this way. Put the what we call at your elbow, left elbow, then the one at the top and the bottom, she told me and she sent me the picture how to do it. And also after that, at the shoulder behind where is the heart. Yeah, to feel it's a bit warm, and that's the place you have to put. Okay, fine. So I've been continue doing that. It was 4 times a day, 4 times for my elbow, 4 times for my shoulder. So, but because I'm a kidney patient or kidney problem, whenever I want to do my dialysis, I have to take my pressure. So I take my pressure. So what we call this, it showed me how much is my pressure, and also it showed me the heartbeat, the pulse. So I can see some improvement, but I continue. Then about 3 weeks, I think sometime toward end of August, I decided to go to Serdang Hospital. So I went to Serdang Hospital. I met a doctor. So doctor told me, what happened to you? I said, but this is my referral letter from Hospital Selayang. They say, okay, let's take your pressure, let's take your oxygen level, let's take your pulse. So believe it or not, my pressure 130/70, my oxygen 100%, my pulse is 71%, 71. So then the sister who did that for me, he said, Tuan Haji, you are okay, no problem. I said, no, this is the ECG that I got from Selayang, which I'm not good. Yeah, he said, okay, fine, let us do the ECG. So they did on the ECG on me, but I didn't know, I'm not good in reading the result of ECG. I said, okay, they say, you wait, let's see the specialist. So I see the specialist quite junior, and then her immediate boss is higher than the big boss of cardiac in Serdang. So they told me, you are okay, there's no problem. So they say only maybe when the time, then your heart beat low, but no problem, no medication. At first they want to give me aspirin, very strong aspirin, but then they realized that I do what we call the water dialysis. They don't want to have internal bleeding. Then they say to me, no, just keep to whatever Selayang give. Then they say, come back 3 months. I said, what? Come back 3 months? I'm okay. I asked the doctor, yeah, you are okay. What have you done? I said to myself, oh my God, this is thanks to madam by giving me how to use and to do what we call for my elbow and my shoulder. Today, for your information, my blood pressure this morning, yeah, when I took it, 110, 60, and then my what we call heartbeat 69. So I'm a happy man. Last time, as a Muslim, when you pray, you have to stand. I cannot stand. If I stand, I feel that I want to fall, So I cannot stand. But now I can stand, I can pray, even I can read long surah, I don't have any problem. So madam, that is to thank you. You helped me a lot. My wife was so very happy. Although that I also control my diet. Diet, as Dr. Hafidah say, is very important. Yeah, so that is the thing. So I think that's about me. If you have anybody have any question to ask, I'm more than happy to answer. Yeah, and for your information, I'll be using this machine, but only one machine. Yeah, since COVID problem. Winston come and sent to my house, I think sometime in early 2020. Yeah. So until then, I'll be using the machine. So what can I say? Fantastic. Thank you very much.
Okay. Thank you very much, Haji Roslan, for sharing. Okay. I always say that nobody knows what happened to our own body. Okay, only our subconscious mind. So when reducing electron go inside our body, it will help, with our subconscious mind. It will help us to recover. I can say that to rebuild, okay, to clean our body. think I passed this back to Anna just now. Who is that? Haji Roslan told say where to use. At the end of this session, I will show to you all how to use this machine. Okay, like what he said, that what photo that I sent. Okay, what picture I sent. So now I pass back to Sharon. Sharon, please. Thank you, Sharon.
Okay, thank you, madam. So from my side, I will now try. I will now share to you all more information about this reducing electron therapy. So the first thing I would like to share is about this self-defense. So you may ask me, what is actually self-defense? Self-defense means that it's the power of our body, the ability of our body to help us to fight any diseases or infections. So let's say if you have a strong defense system, you have a strong self-defense, means that your body is able to help you to fight with any infections or diseases. So self-defense actually consists of 3 elements. You can refer to the picture below. So you can see here there's a triangle, and each corner of the triangle actually represents different traits. The first one is a level of cellular metabolism. This cellular metabolism actually is very important to our human body because this is the process where our cells will be able to convert the nutrients that we absorb into energy, which is required by our body. So if your cells are not able to carry out metabolism, what will happen? These nutrients will be absorbed by our cells, but they cannot carry out the burning process or the process to convert all these nutrients into energy. So these nutrients will keep accumulating inside the cells, and then after some period of time, this will will be oxidized, and then it will release toxic substances. So now your cells will have a lot of toxic substances in it. So when our cells have toxic substances in it, it will become weak, and then slowly they will die. So which is why cellular metabolism is very important to ensure that the nutrients that we absorb actually will be converted into energy that is required by our body. So the second trait is the strength of immunity. As we know, our immune cells are like the soldiers of our body. They are the first line defense against any infections or diseases. So if we do not have a healthy immune system or a healthy immune cells, these cells will not be able to help us to fight diseases, which is why we will get sick easily. The last one is the level of inflammation sedation. Inflammation actually will be triggered by a lot of factors, which includes environmental pollution, the radiation from our digital devices like our laptop, our mobile phones, etc., or even when you overstress or overwork yourself. These factors will actually contribute to inflammation. So if let's say your body has high level of inflammation, it will actually trigger sickness, which is why it's important to make sure that your level of inflammation is always at the lowest possible to ensure that your body is strong enough and will not get sick easily. So if the 3 elements of yours are at optimal level, you can say that yourself have a very strong self-defense, which means that your body is strong enough to help you to fight with diseases. If one or more of these elements are affected, your self-defense will be affected as well, which means that your self-defense is not that strong, and you will get sick easily. So it's very important to ensure that you always have a very strong self-defense. The next one, 70% of our body is made up of water. this water is also a very important element in our body because like human, we want to live happily and healthily. So we need to make sure that our environment, our surroundings are always clean, neat, tidy, and also comfortable for us to live in so that we can be healthy. Now our cells require the same thing as well. This water is just like their home. They need a clean and also a neat home for them to survive in. If the 70% of our body fluid, which is our water, is in a bad condition, which is acidic, our cells will not be able to survive in it. So what does it mean when our body fluid is dirty? Just like I've said, it means that our body has been turned into acidic. So when our body fluid is in the acidic state, our cells will not be able to survive and they will become weaker and then they will die eventually. So our body at that time will be lack of healthy cells to help us to fight with diseases. However, if we make sure that 70% of our body fluid is always at a weak alkaline state, which is suitable for our cells to survive in, they will be healthy and strong, which makes them able to help us to fight with diseases. So it is very important to make sure that the house of our cells, which is our water, is always at a weak alkaline state. So how can we do it? It's by using reducing electron treatment. So this one is like the principle of how reducing electron treatment helps us to maintain our body fluid in weak alkaline state. You can see that the left side of the picture, you can see that is hydrogen ion, which consists of positive charge. So this positive charge is actually bad for our body. And also it will cause acidification, which is not suitable for our cells to live in. And this will cause diseases. If we have a lot of reducing electron, this reducing electron will help us to neutralize the positive charge on our hydrogen ion, and they will release out hydrogen atom, which is neutral charge. So if we have a lot of hydrogen atom in our body, it will make sure that our body fluid is in a weak alkaline state, which is suitable for our cells to survive in. And this will make sure that our body is healthy. So this is how reducing electron help us to make sure that our body fluid is in a weak alkaline state for our cells to survive. So aside from reducing electron, we actually need to take care of other things to help us to maintain our health. So there are actually 6 rules which is suggested by Dr. Noboru Horiguchi to help us to maintain health. So the first one you can see is reducing electron. So by using the ET machine, we can actually ensure that our body has enough of reducing electron every day to help us to restore and build health. So aside from the reducing electron, we also need to make sure that we have moderate exercise. So for example, you can try to walk for 30 minutes per day, or go for a slow jog, or any other exercise that you like and your body can take it. Just to make sure that you are active, you try to move your body every day to make your body healthy and strong. The third one is a balanced diet. So for balanced diet, you can actually refer to the food pyramid, which we know that the lowest level is the carbohydrate, and then the fruit and vegetables, and the least that we need to consume is the fats. So you can refer to this food pyramid and adjust your diet accordingly to whichever suits your body condition. Aside from the nutrients, you also need to make sure that you have enough of water. So you can also check that how much water you need to intake. So to make sure yourself drink as much as water that your body needed. So with the correct nutrients and also enough water, you will have a balanced diet, which ensure that our body has enough nutrients to let us to be healthy and strong. So the fourth one is 7-hour sound sleep, which is 7 hours of deep sleep in a day. Deep sleep means that you are not dreaming, because dreaming considered as a light sleep, which you are still in a conscious state. Deep sleep, when you are in a deep sleep state, this is when your body is able to repair itself. So your cells will be able to repair itself from the work that they have done today. They will repair, and then the next day they will be able to, they are ready to start their work on a new day. So when you have enough deep sleep and good quality sleep, you will be able to feel refreshed on the next day, because your cells are repaired and your body is repaired. Your body is able to work again in a new day. So please make sure that you have also this 7-hour deep sleep in a day. The fifth one is medicine. So as we know, if we get sick like fever, flu, cough, we always go to the doctor, and they will give us medication to help us to ease our symptoms. So medication is to help us to ease our symptoms, but for reducing electron, we actually target the fundamental of our body, which is our cells. So if you combine medication with reducing electron treatment together, you will actually get a better effect to help you to health, because you have medication to ease your symptoms, and at the same time you have reducing electron to help you to repair your cells and to help you to maintain a healthy body. So you should actually continue your medication prescribed by your doctor until the doctor say that you are okay, you are allowed to stop. Then at that time you are able to stop your medication. But if you are still taking the medication, please continue to do so. And last but not least, you should make sure you have a positive mind. This is one of the things that a lot of us that we ignore these days, because a lot of people, they know we need to exercise, we need to eat nutritional food, we need to have a good sleep, and also to do other things to help us to maintain healthy. But what they don't know is actually our mind and our body is connected. So you need to ensure that you have a positive mind to make sure that your body is able to maintain its health. Because if you have negative thoughts like you feel that you are not healthy, you will get sick, you cannot do this, your body is not strong, so your mind will actually receive the signals that you pass to it, and then send all these signals to everywhere of your body. So once your organs receive all these signals, they will actually follow your order. So they will think that you think that your own body is not strong, so they will stop working. But if you have a positive mind, you always tell yourself that you're strong, you're healthy, you want to be healthy. These positive signals will be transferred to all part of your body as well. So when your organs know, they will work hard to help you to maintain healthy and also to let you be strong. So it's very important to have a positive mind, as well as a positive surrounding, which means that the people surrounding you has positive thinking, and also they are very encouraging. They always encourage you to do better. So all these positive thinkings and also the environment will help you to maintain health. So if you follow these 6 rules, you are able to have a healthy and a strong body. So for the basic elements of human body, what we know that is our body need water, oxygen, nutrients, protein, carbohydrate, vitamin, fat, and others. But we don't know that our body actually need reducing electron as well. So according to research done by the WHO, human body actually needs 13 billion of these reducing electron per day to be healthy. Why? Because our body actually has reducing electron in it. However, due to nowadays we are exposed to a lot of different factors, like I've mentioned, the pollution, the radiation from our digital devices like our laptops and mobile phones. All these things will actually use up our reducing electron that is in our body. So our body is just like a fridge also. For example, your fridge, you finish up the food, you will go to the grocery store and buy, and then you put it, refill the fridge with food again. Our body needs the same thing as well. Once the reducing electron is being used up, you need to give back the reducing electron that our body needs. If you didn't give back the reducing electron that is being used, that means that our body will not have enough of this reducing electron to help us to maintain in a weak alkaline state, which is suitable for our body. So which is why our body may be turned into acidic at that time, and then we will get sick easily because our cells are weak and it's not able to survive in it. So by giving back our body that the reducing electron that it needs, and also make sure that every day it has sufficient amount of reducing electron, it will help us to maintain in weak alkaline state, which is suitable for our cells to survive in, and then these healthy cells will be able to help us to fight diseases and to prevent sickness. So it is very important to make sure that you give back the reducing electron that your body is required. So reducing electron is a treatment and a prevention. As we know, prevention is always better than cure. So preventing diseases is the assure of a healthy body. So you can see here, Dr. Noboru Horiguchi actually state that by inducing nature's energy, reducing electron into human body, this will enhance our body's recovery and self-healing power, and then fight diseases without any side effects and treat diseases fundamentally. Because this reducing electron actually targets the fundamental of our body, which is our cells. So we are actually not giving you something extra. We are not putting other substances that your body don't need. We are just giving something that your body already have and it is needed daily, which is why we said that we help you to fight disease and to prevent disease by using your own body power, the power of your own body. It's not like you depend on other treatment to help you to fight diseases. You are depending on your body condition, your cells, to help you to heal yourself and to recover yourself. And this is without any side effects because the reducing electron is required by your body. It's not something that your body doesn't need it, which is why it will not have any side effects. And it treats diseases fundamentally. Like I've said, reducing electron targets our cell, which is the fundamental of our body. So here you can see that we are the root treatment. We are not treating symptoms. So like I've mentioned just now, the fundamental of our body is our cells. So just like a tree, when you want a tree to be healthy, you need to make sure that it has sufficient amount of nutrients, minerals, and water. So all of these things need to go through by its roots. So the fundamental of a tree is its roots. When its roots are healthy, it will receive enough of these nutrients and water. It will be healthy as well. Just like our body, if our cells are active and healthy, we will have a healthy body. However, if our cells are weak and not strong, we will get sick easily. So how many cells do our body have? Our body actually has 60 to 100 trillion of, which you can see that is very many cells in our body that forms our organs and also our body systems. So it is not easy to make sure that every cells are in a healthy state, which is why natural treatment needs time to repair cells. It's not like you use this reducing electron treatment for 1 time, 2 times, or even a day, then we can say that 100% of your cells are healthy. You are 100% healthy. But this natural treatment actually needs time to repair cells, because you can see that our cells, we have a lot of cells in our body. So it's not easy to make these 60 to 100 trillion of cells to be healthy back. So you need to be patient and also give time to this treatment to let it slowly repair your cells and also slowly bring back health to you. So the process of root treatment actually consists of 4 steps. The first one is stop, which is we will stop your body's condition to become worse, or even your sickness to become worse. The second one is cleaning, which we will convert the 70% of your acidic water into weak alkaline for your cells to be healthy and to survive in it. The third one is to repair. So at this state, your body, organ, cell system will start to repair themselves. And the fourth is rebuild. So at this time, your whole body will start to rebuild, and you will rebuild your health as well. So root treatment actually consists these four important processes. The first one is to stop your body's condition from getting worse. The second is to clean, to convert your 70% of water, acidic water, into weak alkaline. The third one is repair, which your body cells will start to repair themselves. And the fourth one is rebuild, to rebuild your whole body and to rebuild your health. So aside from like being active, using the reducing electron treatment, I've also mentioned that we need to have positive thinking, a positive mind, because healthy body begins from healthy thought. So when we are conscious, like we make decisions, we try to brainstorm ideas, this is all controlled by our conscious mind. However, if we want a healthy body, we want our body to be able to fight diseases, we actually need to communicate with our subconscious mind, because this subconscious mind will actually send the signals to all over our body, which our body will receive the order that we want to be healthy. So they will follow the order to be healthy and strong. So it's very important to always communicate with your subconscious mind to tell yourself that you want health, you want to be healthy, you want to be strong, so that this subconscious mind will actually convey your message to all parts of your body, and your body will do its job to make sure that you will be healthy and strong. So this is the founder and inventor of the reducing electron treatment, Dr. Noboru Horiguchi. Just like us, he also experienced the loss of family members due to diseases. So at that time, he actually saw the limitations and the weakness of the medical field. So he wanted to find something that will be able to help people to reduce their suffer, reduce their pain, and also to prevent diseases. So after years and years of research, he found that this reducing electron is beneficial and is able to help humans to prevent diseases and to maintain health. So he also started his own hospital in Japan, which is Horiguchi Hospital. And currently, this hospital is taken over by his son, which is Dr. Hiroshi. And Dr. Hiroshi also trained doctors, a lot of doctors, on how to use this reducing electron treatment to treat all kinds of diseases and patients. So this invention also earns a lot of awards, which you can see here. We have 8 major awards. And the most important one is the awards that you can see here, which is recognized by a lot of countries, which their healthcare professionals actually state that reducing electron treatment can help to prevent diseases and also to maintain health. So we also is a registered medical device. So the cert you can see here is from Japan's Ministry of Health, and the other one is from our own Malaysia's Medical Device Authority. So this reducing electron treatment is a medical device. So why does Dr. Noboru Horiguchi earn awards? Because he discovered and invented something that is equivalent to what human body needed. Like I've mentioned a lot of times just now, reducing electron is already in our body and is what our body needed. Because Dr. Noboru Horiguchi found that our human body needs this, and he invented something that is able to give us what our body needed. So that's why this invention earned a lot of awards. And why it does not have side effects, I've also mentioned already. Because reducing electron is something that we are born with and is what our human body needed. So it's naturally what our body needs. It will accept, and it will not have any side effects. Okay. So currently we have two products. The first one is the Me Energy, which is the bigger machine. And the second one is the IGE1J, which is the blower. So these two machines actually has the same function, which is to produce reducing electron. However, the application is slightly different. So for the Me Energy, you can see we have the electrode plates. So how we use it is by using the plates to put on the part of our body, and then the reducing electron will be produced by this machine and then go through our skin and into our blood vessels. So our blood will carry this reducing electron to all of our body. For the blower, the reducing electron goes into our body through inhalation, which means that when you breathe in the air, reducing electron will follow the air to go into your nose and then your respiratory system and then into your lungs. So this blower is actually very good to help you to clean out your lungs and to strengthen your lungs as well. So for the treatment, we actually use both of these machines at the same time. So the big one will help you to gain reducing electron and let it be transported through your bloodstream, and the blower will let your lungs to be strong and healthy as well. So when you use these two machines together, you will have a good effect. Okay. So if you are interested in understanding the level of acidity in your blood, you can actually register with us to get a free trial. So the contact number is down below. Because sickness comes from acidity. So like I've said, if 70% of your body fluid is in acidic state, your cells will be weak and will not be able to survive, which will cause sickness. So it's very important to ensure that your body fluid is always at a weak alkaline state to let your cells to survive and be strong and healthy. So if you're interested to find out how acidic is your blood, you can always WhatsApp the number below to register with us for a free trial. So we will have a medical science officer to explain your condition to you. So aside from that, we actually need your help. So this reducing electron treatment actually exists in the market for only 25 years. So this is why this technology is still not included in the education of medical students. However, we can see the effectiveness and potential results from our patient. And also because this is a registered medical device, we are restricted by the FDA to perform any direct advertisement. So we only can rely on satisfied users like you to help us to share about this beneficial treatment. So if you think that this reducing electron can help the people around you, like your family and your friends, to invite them to listen to the talk, or even to register with us for the free trial. Because this online sharing session that we set up every Thursday and Saturday actually serves as a platform for you to invite your friends and family to know that aside from the Western and traditional medicine, there is always an alternative way to gain back health. So if you ever feel like it may help the people around you, please share to them regarding this reducing electron treatment. Okay. So I think my sharing is until here. Do any one of you have any questions? No question. I think no question, right? Then I'll pass the time to Madam to let her share on the reducing electron treatment.
Okay, it's my turn. Yeah. Just now you heard about Haji Roslan said that how I teach him how to use to protect the heart. Okay. So sometimes nobody will know that actually what happened. Yeah. So like what just now I said, that only your mind, know what happened. And reducing electron is needed for our whole body function. It's just like a factory, every department also we form already, we have. But the thing is, we did not on the electricity, so cannot function. So actually reducing electron is needed by the body to have a proper function. And this application of this reducing electron treatment actually is not based, it is not to treat diseases, but actually is to increase the self-defense power of individuals. So when you have your self-defense, if your self-defense power is very good in your own body, it can function by itself. Okay? So you need to understand that we are not the symptoms. Like what Haji Roslan one is the symptoms. Okay, the heartbeat maybe is only 40, you know, there's already symptoms. Means that there's a sickness of your heart got problem. But the thing is, when you go to do ECG or you go and do other things, what are the things that you treat on it? But sometimes you cannot see what is that cause, you know. Sometimes, of course, you can know, but sometimes you do not know. So only our subconscious mind know. That's why you see, you need to put a lot of things inside, you know. You need to eat good food, yeah. So you need to do exercise, all this, but without reducing electron, it will not help you to have a proper function. Because of this is very important. The metabolism need what? Need reducing electron to burn. This is very, very important. That's why a lot of time when you go and see doctor, Chinese doctor also, he said that, oh, because of your energy is not enough. Qi, your qi is not enough in your body. Actually, what is the meaning of the qi? The qi actually is equivalent to reducing electron. But the thing is, in the medical book, nobody go and study it. So all of us here today is very, I can say that very, very lucky, because you are the first batch that know the reducing electron is so important to human body to function well. Okay, so you are very lucky. I always been very grateful that I'm very lucky. You know, I have eaten the morning Western and evening is Eastern medication. So it is quite half a century, you know, until I met this reducing electron machine. Okay, then within 3 years, I did not consume of any Chinese or Western medication. I really grateful for the, you know, mighty God's arrangement. Yeah. Okay. So now I will go into this how to do the treatment. Of course, those that who follow my session, you know that we talk about the treatment. We got three types of treatment. One is prevention, you know, from this RET, reducing electron technology treatment, and also treatment. Okay, and we also can use as a targeted treatment. So actually, can next. So this one, doctor use follow the meridian point. Okay, this is for the, what is that called, the what, ischemic heart disease, non-acute phase. Okay, so this is often accompanied by disorder of the autonomic nerve and stiffness of the shoulders. So when you feel all this, okay, if you feel often disorder of the, or you have this stiffness of the shoulder, so you can use this method. Okay, you look at the front. Okay, the small y is the left side. Yeah, you must understand that for the blood circulation, or you see the back side. Yeah, okay, she use on the what, the finger there. Okay, finger and the palm. Okay, fingers and palm, and the one also the Y there on the leg near the finger, but not on the center. Not on the center. You must be careful of this. And another side is, you look at the back, Y, A, that's on the shoulder. Okay, and the leg point there. So this one you can start with the 20 minutes per session. Okay, and 2 times a day. So treatment interval is 60 minutes. Okay, by the way, in Chinese, this one, Islamic heart diseases, actually is kekurangan, kekurangan darah in your heart. Next. Okay, so this is a second way of doing this. You see the front there, you can see the pusat there, nerve there is below there. Chinese, that is called tan tian. Okay, that's one of the meridian point, and about 2 or 3 fingers down, it's about near the private parts there. Okay, you look at the front. Now look at this. You see, he put the Y front. I left side one front. He put on where? Near the. It's not finger, near the palm there. Can see the small one put on the palm there. It's not finger. Okay, another black Y, also the palm. Okay, we look at the back, the right diagram. You see the A, where the A you put is the both of the shoulder blade, yeah, center of the shoulder blade, and put on the backbone there. That backbone, okay, is to the meridian point, there is a heart point. Okay, so now you can see the Y, black Y. You can see the finger, correct? Not the thumb there. So that means this one near where? Near the center, a little bit near center there. Because you know why people do the reflexology, foot reflexology? Because our foot is all reflect on our organ, our whole body's organ. So all this is, you can just follow this. Okay, so the treatment time, you can put it 30 minutes, and 2 times a day, and 60 minutes is a treatment interval. Okay, the notes there, regardless of the cost, discontinue the treatment at once if there is chest tightness, okay, tightness, or increase in blood pressure. You stop for a while, yeah, okay, and you, after you feel that, you just stop for a while, then you start again. Because you see, when you use this, it will fasten your blood circulation. So a lot, this is called the healing crisis, but sometimes too much of healing crisis, human cannot tahan, cannot stand, so you stop, you don't use. Yeah, okay, or you can reduce to maybe from 30 minutes you can reduce to 20 minutes, yeah, Okay, so this one is ischemic heart disease, not the heart's not enough blood. Okay, so now another heart disease, the second one. This is a chronic heart failure. Okay, this is a chronic heart failure. That means our the force of myocardial contraction is chronically reduced. Okay, it will take time slowly. So it may be accompanied by shortness of breath and swollen of the face and lower legs. That's why when Haji Roslan have all this, I asked Haji Roslan, do you have a shortness of the breath and swollen on the face and lower legs? According to him, he don't have. So to me, it's like that. If let's say when you don't have all this, I can say that is maybe it's an old age. It's an oxidize of the cell in your heart. Okay, so your heart will be slowly no strength. It's already old. Things is old already. So when things old, okay, your organ old, then if let's say we follow the what is it called, our fundamental of what RET, reducing electron treatment, it can help us to rebuild, okay, rejuvenates our cell in our heart. So that's why I teach him to use another way that afterward I will touch on it. Because his one, he say he's not in this condition. So when this not in this condition, I teach him do another target one. Okay. So this one we come back to chronic heart failure here. So when you want to do it, you can follow this 20 minutes per section. You see these pictures of the left side. You see now pictures of the left side. If let's say people got this chronic heart failure, you see he used a different way already. So the small pad just now is in the palm center, isn't it? Now it's near the finger. You see, near the finger. And then now we go to the right side. Then the big black A is near the finger there. Can you see? Okay. And you see the small black Y is near the thumb there, correct? You cannot see thumb anymore. Okay, because all this they got their research on because they are still doing the research how to put in the human body entry the reducing electron the best way now. Okay, so we refer to the right one back. So you look at the back one, you can see the Y. Can you see the Y? Now the Y is near the. Can you see near the shoulder plate? The shoulder plate there, the bottom of the shoulder plate. Can see? Then the white A also the same level there, and you see the white Y. Can see the white Y? It's near the finger, the thumb there. Okay, so you can do it maybe 20 minutes per session, 3 times a day, and treatment interval is 60 minutes. Okay. We cannot, when you buy that time, we cannot tell you to do a lot of things. We only teach you do the hand and leg. You know why? Because all the hand and leg is the all the whatever la nerve okay, to the head to the leg is the best way. Okay, but when you have any diseases, you must always refer to us. Then we teach you how to do some concentration point. Okay, and of course, for you to maintain hand and leg is the best. Okay, we have already done 11 years in Malaysia. Hand and leg already have a lot of miracle happen. Yeah. Okay, but now we want you to have better way. That's why you attend the course. We every time we will increase you something, you know, the knowledge for you to know more about this. Yeah. Okay, next. Okay. Okay. So this one is the second, the treatment tool. You look at this front. Okay. You look at the left pictures. This one, the A. Okay, is about 2 fingers down. Touch your almost touch your private part there. Okay, and you look at the Y. Now you can see the finger come out. So this is to your center of your palm. Okay, center of your palm here, because palm also reflect on the organ. Yeah. Okay, the meridian point is a meridian point. Okay, and you look at the front, small y also put on the palm there. Yeah, and the back, right side. This one, always people got this salah, you know, wrongly put. You see, it's not directly opposite the white A. Okay, the black A actually is a Mingmen for Chinese. Okay, this is a very important part. The black A for the back side, black A. And you can see the black A. It's above, near. Actually, it's near your waist there, really. Yeah, near your waist there. Very important. And I tell you, this is very, very good. If you always do this, it really can help you a lot. Yeah, you see Chinese Ming, Ming is Nyawa, it's a life. Men is door, door, life door, Ming Men. You know, all this, they got a meridian point name. So the black A there, and you see the Y, black Y. Now you can see the thumb, correct? Now you can see the thumb. You put like that, no? It's a little bit near the your what is that called? Your center of your leg. Okay, and 20 minutes per session, about 2 times a day. Treatment interval is 60 minutes. Note that regardless of the case, discontinue the treatments at once if there is a chest tightness or palpitation occurs. So, so some people after they use, you can feel the palpitation, your heart beat fast. You scared? Please stop. Okay, and reduce. If you put 20 minutes, you reduce to 15 minutes or 10 minutes. Because you must know that too much of healing crisis, you cannot stand, and you were scared. So when you go to see doctor also do not know how to treat you. Okay, it's because of when reducing electron, when the things is started, working in your heart. It will give you the heart faster beat, you know, because working, repair, correct? But the thing is, too much of repair also very noisy, correct? So stop and make it slow down. Yeah. Okay. This palpitation also, last time I take medicine, I also like that, but I cannot warm it up already inside. But doing this, if you feel that, I do not know whether you have feel all this. That's why we always ask people that who bought our machine, anything, please refer back to our office. So because of our experience, especially I'm using this for about 15 years. 15 years. Okay, so I know I go through a lot. That's why I am a person that I'm the intensive user. So when things happen, when you call office and office cannot answer you, they always refer to me, then I will answer to you. Okay, so so just now I already talked about two types of using on the heart disease. Now I go to the targeted method. Next. Okay, targeted treatment is not from it's not from apa tu? From Japan real tech, yeah. It's from my experience, and because I got few types of training. I got a teacher from Taiwan, China, and also different teacher from Japan. That's why this is another way that I learned from one of my master. So you look at this one, you see the front. This is what I teach Haji Roslan. Not only Haji Roslan, I teach not only Haji Roslan and few people about this way, targeted treatment. Okay, so now I'm doing the targeted treatment. I show to you. Actually, I cannot see my pictures one. Okay, but you can see, you all can see me. Okay. Sherry.
Yes.
Can
Can,
see me.
can.
I cannot see myself in my. Now you see, I use this one. I use this one. Very good for your heart, man. For those who want to maintain your heart younger one. This is what I am practicing now. I thanks Haji Roslan for giving me a lot of example of him in this year. So because of him, I also used to do this one. Very good. I teach few people do, now their heart is very good. So now you see, I put like that. And actually very easy that I'm doing. You see how I do? I take out, then I off it first. Okay, I take out, I teach you all how to do it. You see, I use this one. I use this, okay. I will, please wear this one, because sweating a lot. Here, sometimes will sweat. So you put like that. Then you use one, you use center one, okay. Then you put like that. You just put loose, okay. Then you know how I do? I will masukkan. I will put like that. Easy to eat now. Then let's do this. Another one. Yeah. You wear the small one, the big one, then you just put in like that. So easy. Just like that. Okay. And very good for hearts because I also, 50 years of Western and Eastern, all the tablets make me not so, my body, of course, not so good one. And because of the old age, I found that the age you're catching up, of course, all the cell also, organ, will be weakened. But after use this one, after use this Realtek, the machine, the energy, full of energy, I can give talking few hours, one session, just like that. This is not, I can do it in previous years. That's why I really grateful that in my life, I got chance to put in this reducing electron in my body, okay, to increase my body function. I'm really grateful. Thanks God for all this good arrangement. Okay, we come back here. Now you can understand how to do. This is a targeted treatment and not from Realtek. It's from the other teacher teach me one. Okay, then the right side, you can use like normal. Okay. Okay, then I teach this Haji Roslan to use 4 times a day. You can use it for 14 minutes per section. Okay, and the treatment interval is about 60 minutes. Okay, the next one, targeted treatment. Next. Okay, you look at this front. When you go to see doctor, doctor wear that one called what? To listen to your heartbeat, correct not? Then doctor also listen to at the back. So you put on that. And the front one, left side, okay, here. And the back side is, you see the heart there is between the backbone and the shoulder blade there. You put on it, okay? And you use this one even though you don't have any but you can, after you use you can feel that your heart will be younger. Okay, you can do it 20 to 30 minutes 4 times a day. Then okay, the treatment interval is 60 minutes. Okay, so Japan next. Okay, Japan also give us this 2Me energy treatment method. So you can use, this is the way that they are using. So this one is they activate your autonomic nerve system. According to 2 years ago, their research, when a person autonomic nerve system is in order, all the sickness will be reduced tremendously. Okay, next, no more. No more. Okay, so I hope that my sharing really can help you all. Okay, then I'm thinking start from next week. I will do it only once a week. Once a week. Okay, then please, I will do it Saturday afternoon. Yeah, so I hope that by doing all this can really help you all. Please invite your friends to attend. Because we will not simply go and contact your friend, because Zoom cannot take any people's name to call. Okay, so just invite them to understand beside the now the new modern medical treatment, okay, and the Eastern way of sincere all this, there is another alternative way, because this way is only about 25 years launched in the market. And Dr. Fida also told us that she studied 7 years of this medical books. This subject is still not in the medical yet, the medical school yet. Okay, so that's why Dr. Hiroshi, because in Japan, we got about 400 over hospital doctor is using our machine to help patient. So in Malaysia, no hospital is using, but we got a very good testimonial, yeah, in Malaysia. Sad to say, we invited people, they were not agree to share. Okay, so I hope that next time, if let's say you all think that you want to share, and you think that you got anything to share, please share, whatever things, because we are the seller. People will say, oh sure lah, because you sell, so you can say anything, correct or not? So you say one words better than we say 100 words, correct or not? So I really urge you all, if you think that you can see some goodness of our after you use and you feel that very good. I hope that it's just like Haji Roslan, he always like to share. When I ask, he like to share. He volunteer, he say, oh good, because he really benefited from this machine, this device. So after I say like that, anybody want to share? Yeah? Anyone want to share any good, anything that after you use, you feel that very good? You just unmute the mic and you can share. Anybody want to say anything? No. If no, today meeting, now is 4:37 already. If nothing to say, we will see you.
Madam.
Yeah. Haji.
Yeah, I just like to, if you can tell these people what you told me, because after my operation and after I do the water dialysis, especially at night, I start at 9:30 to 10:30, sometimes to 11 o'clock. Then my body become very active. So I only go to bed, I can only sleep maybe only at 3 o'clock in the morning. But now after you told me where to do it, before I go to sleep, I do it for 40 minutes. So by 11:30, I have a deep sleep early. Because in the health, when you have a good sleep, you'll be very healthy. Sometimes that you lie down, but you cannot sleep. So either you can tell them today or you can tell them the next week or whatever, but that is to me very important.
No, I can tell them what to do. Actually, all this, you all, thank you very much, Haji. You see, this is very good for people that cannot sleep. Because I always stress here, it's not my machine treat you, help you to gain back your health. It's not. It's your mind, your subconscious mind. Now you listen to me. I talk to you. I'm using the conscious mind. I'm using the conscious mind to talk to you. When we consciously participate in our cannot be speed up. That's why you see when you operation, you got surgery, then doctor will give you sleeping pill, because doctor want you to shut up your conscious to sleep. Because when you sleep, especially no dream, your subconscious mind will actively help you to repair your whatever abnormal in your body. So you need to sleep very well. For those who cannot sleep, you do it this way. You put the big one, big and small like that. Okay, you know you're on the meridian point called temper. You know how you find temper very easy. You know when you bite like that, you bite. Everybody can bite. Then you can see here there is a movement. Correct? Then you put this one on top. Then you put here. Okay? Of course, I teach you how to do it. When you do this, you got this, isn't it? The center one, the apa tu? Panjang, medium size. Very easy to use. You do it here. You ikat dulu. You tighten first. Then you wear this glove because here also a lot of sweat. Then you put in. This one also you put in. And you need to tighten up, yeah, because you will sleep one, very good sleep. So you know, that's why you need to quite tight now. You do it, very good sleep. Yeah, you can put it, start with maybe 20 minutes, then you can slowly increase to 30 minutes. You know, yeah, it's really very good. I tell you that now, when you all got time on to listen to my own here's when I was now, of course, you know my age. I told you all. There's a few years ago, I crossed 60 to 61. Last time I don't use this one. I crossed. Then I found something. When I walk from my bedroom to my hall, okay, I forgotten what I want to do. I forgotten, you know. I said, oh my God. Then a few times like that, I said, oh my God. So the first thing is I always back to the fundamental. I know that it's because of the first thing is because our head, the fluid of our head, the water of our head is about 70 to 75. The first thing is I need to clear my 75 water from acidic to weak alkaline. So I clear from weak alkaline, okay. Then I start to take something that you go to pharmacy, you can ask, what is good for brain? You need to eat, okay. Then now few years until now already, thanks God, very sharp. My memory very sharp. Yeah, really thank you. That's why you see Parkinson. Okay, what's that dementia problem? Yeah, forgetful and Alzheimer or Zima, what's that? I am really confused with these two. Okay, and it's very good. Use that. And especially people already getting old and you start to forget, you need to use that. Otherwise, one for whatever wind already got problem, stroke come, everything come. The first thing first, go and purify your brain. Okay, the fluid. Yeah, thank you very much. Now Haji Roslan really trust in our machine. So all the best. Okay, bye-bye. Now already, what time? It's already 44. We over a few minutes. So thank you very much. All the best. Bye-bye. See you all, yeah.